Talking about something very important today, and what is that? Female diseases of the female reproductive organ that causes issue as regards to infertility. And what are those diseases that I'm talking about? I'm talking about PID, which is pelvic inflammatory diseases. I'm talking about ovarian cysts. I am talking about endometriosis. I am talking about adenomyosis. These are some female reproductive diseases that causes issue when you come to fertility. They really, really cause many issue when it comes to infertility. So now, when you're talking about PID is pelvic inflammatory diseases. This is just the accumulation of two or more different infections in your body system that travels all the way from your vagina to your reproductive organs, and at the end it causes a big problem and makes it very, very difficult for you to conceive when you're looking for a child. So mom, please, what do you have to our doctor, what do you have to say about this issue of PID?
Give, thank you. Thank you, you raised this topic. When you told me what you were talking about today, I became happy. Why am I happy is that people will come to the clinic. Imagine a woman having endometriosis telling you she wants to conceive. A woman having PID, next thing she's telling you, can I conceive next? I want to conceive, I want to carry my child. Somebody with ovarian cyst, I want to carry my child. Sometimes I'll be like, I asked a woman this morning, do you think we'll do magic? These things are not magic. For example, the PID she raised up now is not one disease. For this, if you do pelvic scan for the sonographer to be able to pick that PID there, that means you are having like 3 to 4 infections. You are having staph, you are having E. coli, you are having name it. They will not come and form a fluid in your womb. It's just there. And this PID is very dangerous. As funny as light as we'll take it to be, it's very, very dangerous. It can hinder a woman from conceiving, and she will be looking for village people that is chasing her from the village.
Exactly.
Whereas there's no village person chasing you. Imagine when you have fluids in your womb, what does it do? These fluids start finding their way to your to your fallopian tubes. You see some women, they will go and do HSG, they will tell them they have hydrosalpinx, meaning there are fluids in their tube. This fluid now, how do you want the sperm cell to swim across this fluid to go and meet your egg? This is a very serious issue. Gives, thank you for raising up this problem. It's serious. You don't have PID and come to my office and tell me you want to carry your child. What do you want me to do? Put we can suck out everything. You have to go through treatment process. We'll start by treating the infection. Next, we'll dry up the fluid. Then we'll open up your tubes, because whether you like it or not, for the fact that the fluid has find its way to your tubes, even if you treat the infection and it goes without cleaning the tubes, it's still a problem.
Yeah.
She made mention of endometriosis. Oh my God. I wish women would take time to use Google to understand some of these things. If you have been diagnosed of an ailment, I know Google is the quickest way to die, but you can do yourself good by researching. This thing now that doctor said is my problem. What is it?
Yes.
What do I do? Is it curable? Will it affect fertility? What will it do to me? Imagine somebody having endometriosis and is telling me when I will carry my child. Endometriosis is a serious infertility problem. Hear me today. It's a very serious infertility problem. That if you go for surgery, what the doctor does is to scrape your womb lining.
And most of the times they may not even get it.
It's even dangerous. Imagine scraping your womb lining.
Yes.
What if we scrapes and take away the thickness of the uterus? How do you want to carry your child? So when you have issues like this, endometriosis is curable, especially when it's not very advanced. It's not the acute one. Yeah. It's very, very curable. You can manage it and you have your kids. But why we are bringing some of these things to the forefront is for women to have better knowledge and really know what they are facing. Not when you have such issue, you come to the doctor, they tell you bill, you are angry.
And most of the times, if you tell them just give us 6 months, they'll be like, can't it happen in 2 months?
2 months. You're like, sometimes I sit and ask me, it doesn't mean that this person doesn't really is going through. But if you had used Google, yeah, man, I have a serious issue. What can I do? Then whatever the doctor is telling you is making more sense to you because you already have a knowledge of what you are to do. Then when you come to the you go to clinic and they charge you, you don't start feeling like, is it no be to born pikin, I've bought. Imagine somebody coming to tell me, I've drank. You've drank in endometriosis. You have endometriosis, they are drinking ovulation medication. Which magic do you want to do? So please, you people should thank Nurse Gift for some of these topics she's always bringing up to enlighten the female folks and couple looking for the fruit of the womb in general.
Yes, thank you very much, ma'am. Another thing I want us to talk about is ovarian cysts, because
Okay.
a whole lot of women now, once they go for test, it will just be confirmed that they have ovarian cysts, and most of the time they'll be asking, "What is ovarian cyst? What is it all about? What is the cause, or what does it look like, or
Okay.
what, as in, like, how did I come about this ovarian cyst?" So
Every woman, immediately after your period, you will always have this cyst. It's normal, but it should go away after some time. But when it doesn't go away, if it remains and it becomes painful, is infected, that's when you now have the serious. I don't want to go into medical terms. I want to keep it
in
simple
a layman's language,
that
so
everybody will
everyone will
understand. So when you now have these complex ovariances, you need treatment. So hospitals at times do surgery. They'll tell you they want to do surgery to remove the cyst. In some cases, they will insert something to suck out the fluid. Then herbally will give you medications to clear that fluid and the infection so that the cyst will go away. This cyst is, in some cases, you see some people, their tummy is so big, like you're having fibroid, ovarian cyst. If you see who is suffering serious ovarian cyst, you pity for them. Oh. It's not a joke. It's a very serious fertility problem. And when your ovary is having a cyst, how do you want to produce egg and start getting pregnant? But normally, every woman has this cyst that goes away after some time. But when it becomes complex, you need to seek medical attention. Thank you.
Okay, thank you very much, my doctor, our one and only doctor. So she's here with us, and I hope you're enjoying this live show with us. Please, please make sure you have your writing materials, because this is very, very educative and informative. And also, you can also invite other people to join, like, comment, and share. So, another thing again is adenomyosis. Most
Oh.
women, they come here, they be like, "Oh God, why am I
Mm.
trapped with this sickness called adenomyosis? How can I come out of it?" And most of the time, they don't really even understand
Understand.
what is adenomyosis.
NEPA don't take light. It's a normal thing in Nigeria.
So how can they understand, or what do they know
Please ask
about
Felix
adenomyosis?
Wadigen. Chisom, please up the whole ACs, even in my office. Then let them on generator.
So, what can you tell them about adenomyosis? What it is all about?
Please, we are going to on generator shortly, so join us. Continue staying with us. Adenomyosis, my sister. Hmm. You heard when you mentioned that word, I said, that's a very complex, very complex fertility problem, and that you don't even wish for your enemy. But peradventure, as a woman, you find yourself in it. What can you do? You just be positive about life and be focused. Adenomyosis, herbally, there's a cure for. I have a lot of patients that have been taking on adenomyosis, and they can testify that we've been able to achieve results.
Okay.
Then medically, there is nothing. The doctor will tell you either they scrape it off, which is dangerous. The doctor might scrape and might not get it right, which results to bleeding, the woman dies, or it makes the walls of the uterus very thin. Adenomyosis is, and it's difficult to diagnose. That's the most difficult thing about it.
Yes, because one woman told me that she went for surgery, they opened up her uterus, they couldn't see anything, they closed back everything.
Yes, that's adenomyosis. Some people mistake it for fibroid. Some sonographer will be seeing fibroid. Some sonographer will be seeing adenomyosis. So if you are being if doctor says you have adenomyosis or you went to lab, they say you have adenomyosis, I would advise you to run couple of tests, do couple of tests, be it pelvic scan, HSG, to reconfirm, because
Yes.
there is this mixture between adenomyosis and fibroid. Please, please. And when you have it, be positive, because with change of diet, change of lifestyle, it can be managed. Thank you.
Okay, thank you very much, our doctor. Thank you for this
Mm.
wonderful information. I believe you all have known what ovarian cyst is all about, what
I'm coming.
endometriosis is all about, what ovarian cyst is
You
all
give him two
about.
five for the waiting.
So,
Woman
if
paid
you
for
have
baby.
any of these problems,
Paid, give me
don't
2,500.
try to jump
Then give me
into
1,000 for
conclusion.
transport.
It's very pertinent to conduct
2,500 for baby. She
series
paid for
of
baby.
tests,
Then
be
give
it
her
pelvic
1,000
scan
to
test,
take and go to
be
next.
it
Call
HSG,
her.
for you
Sorry,
to be
police
able
send
to
the product.
ascertain
They are
and
sending,
know
she will
if
know.
it is
So if you're
really
going to do it before,
what you are passing through. Because most of the
give to
times you can
Daily.
go to a scan and they
Please
tell you this
call.
is what you have. Maybe you have
No,
endometriosis.
it's Abu
And you
Dhabi.
still go for another scan.
Okay.
They will
Okay,
still
when
tell
she
you
go.
maybe it's not
So where
endometriosis, so
you
it's
stay, you
ovarian.
also phone.
So make sure that you
Have
carry
you
out
blocked your account?
series of tests so that you can be
How do you
sure
retrieve your line
of
back?
what you are treating. Carry out series of tests, not after going to one scan result you now draw your conclusions that that is what it is. Just do series of tests, do HSC, do pelvic scan tests to be sure that if it is adenomyosis, it's adenomyosis, and you don't have anything to panic. You can just go in for treatment. As you all know, we treat all of that. All those things are treated naturally with herbal drugs. So do well to chat us up or send us a DM in case you're facing any of these challenges. So on that note, you're going to draw a curtain for today's show. Thank you for being with us. So, Madam, our doctor, please, what do you have to tell your followers who have joined us today on the show?
Uh, I just want to say thank you for always being there for us. Then if you people don't want give to stop cracking, because this thing is not easy. Going to look for topic, getting informations to talk about, adding it to her job as a nurse in this clinic is hard. It's very hard. Then we'll come live, we will not see more than one or two persons. With time, if people don't want to cooperate with us, I'll tell her to face her work and stop stressing herself. People should appreciate us gift now. Please, I'm begging. I'm not the one. I'm not the person behind this program. I just have to tell you the truth. Every day you see Ijenwa with lifestyle with Ijenwa, appreciate nos give. Dash her something, give her money, give her airtime. It's not
I
me.
need money.
Me, I cannot do it. Oh, my table is filled up. Most of even when you call me sef, sometimes I can be harsh. My schedule is filled up. So there's a way to appreciate somebody. So she goes out there every day searching for topic. Take it or leave it, you are learning something from her every week she comes online. So appreciate her, then invite people, stay online, ask your questions, talk to her, so that she will see that motivation to keep doing this lifestyle with Ijenwa. Thank you and God bless you.
Yes, thank you very much, Ma. Thank you for your contribution. And please, for those that joined us, thank you very much. And I bet you don't want to miss next week's lifestyle with Ijenwa. It's going to be very, very educative. It's going to be very, very interactive. It's going to be fun. We're talking about fashion. Oga no dey touch you. Wetin cause am? Na next week you go know wetin dey cause am. It's going to be a different
Yes.
thing altogether.
I will like that one.
Okay.
My body no dey wet, wetin dey cause am?
Yes, so my thing no dey wet, my thing no dey stand, wetin dey cause am? Even if I dey waka, oga no dey see me, e be like say na ghost dey waka. Na next week you go know. Thank you for joining
I will
us.
be bringing one of our one of our crazy staff, Chidinma. She will like that kind of talk.
Okay, thank you very much. Do have a lovely day. Bye.
Agbafuona mo. Please give me my phone. My